everyone, welcome back. We have another Derm Reacts video and we're joined today with Dr. Sam Ellis.
Hi.
She's a board certified dermatologist up in Northern California and we're really excited to have you here.
Thank you, I'm so excited to be here.
So today's routine is really interesting to me because we're looking at Lala. She is 26 and she has PCOS, and I see the conversation online all the time of women saying that they have PCOS and they find that they have all these different issues with their skin. And they say, you know, that PCOS just makes it so much harder for them to deal with all of these things.
It really does, yeah. So PCOS stands for Polycystic Ovarian Syndrome. One of the kind of hallmarks of that is you have something called hyperandrogenism, meaning that the hormones going through your body, technically considered male hormones, are kind of exerting their effects on you as a woman. So you might have things like excess hair growth or increased acne, and 90% of people with PCOS will have a skin finding.
Before we get started, if you love skincare, make sure you like this video and subscribe to the channel. You ready to get started?
Let's do it.
Hi Susan, this is Lala. I'm 26 years old from the Philippines. So a few things is, one, I have a very oily skin. I didn't have much breakout in high school, and then I started breaking out around 22, and then my derm suggested or gave me Accutane, one round of Accutane, and it was all gone. However, it came back last year around the start of the pandemic, or the lockdown basically, and I'll show you a video of my face last October 2020.
Firming peptides in it, so I like to wear this in the evening if I feel like my skin is a little bit dry. You can really see this really complements. And then another moisturizer, very light moisturizer, has a little retinol content in it. It's probably there more to serve the purpose of a preservative than to actually.
I love that she's listening to it.
I can hear you in the background. I was like, that sounds familiar.
It has gotten really bad, and I went to a different derm again, and she gave me Doxycycline, I believe, and Doxycycline, is that how you say it? And then she gave me Tretinoin and an acne soap, bar soap, and then it only lasted for like 3 weeks, and it has gotten better. And then I did my own skincare by then, which I will be showing you some products.
People that go on Accutane, she said it cleared it up.
Yeah.
And then it came right back.
Yes.
Normal?
Yeah, especially for people who have more, especially in women, who have this more hormonally driven acne. We know that Isotretinoin or Accutane is really good for most types of acne, and it can temporarily clear up this more hormonal acne as well. But if you have underlying PCOS or your oil glands are very sensitive to the hormones circulating in your body, then it's not uncommon to sort of have some rebound acne after you finished Isotretinoin, especially in the location she showed, that like lower face, neck especially. That's so classic.
She actually gave us some really close shots of her skin and what she was dealing with. Did that give you a really good idea of what it would, like, would you say it's pretty in line with someone having PCOS?
Absolutely. She has very cystic acne, lots of inflammatory papules. The distribution is really classic. And then she had some early scarring as well as what we call post-inflammatory erythema, which is just sort of redness after inflammation, which I think will actually go away. But yes, pretty darn typical.
Erythema, that post-inflammatory erythema. I think a lot of people assume that is also acne.
Yeah, all the time. I tell people when they're trying to assess if their acne is better, touch your face. And I know it sounds bad, we always say don't touch your face, but texture can either be acne or acne scarring, but redness really isn't. And I have lots of patients come in after 2 to 3 months on a regimen, they're like, Dr. Ellis, nothing has changed, but everything is flat now. They don't have those inflammatory acne papules or bumps anymore. It's just redness as like a little footprint of where they used to have something.
So they just need to go through one more just round of just being patient, letting that go away.
No, I love when I see that because it means their acne is on its way out. They just have to let that part fade away.
So then she went to another dermatologist. I always actually want more information when they're like, I went to a dermatologist, everything worked. Then I went to another dermatologist. I'm like, what did we miss right there in the middle? Like, did you just move, or did you not like that derm? What happened? But she went to another dermatologist. That dermatologist put her on doxycycline. She put her on tretinoin and a acne bar soap, which I was like, that's not, I wonder what that was.
Yeah, I'm curious why she pivoted to a different dermatologist as well. You know, doxycycline is an antibiotic, but also has like pretty strong anti-inflammatory properties, so it can be good, but it's really not a cure. It's very much a temporary solution, and if someone has underlying PCOS, I get a little nervous about them being on doxycycline because I just know that once that doxycycline goes away, it's gonna come right back. But then tretinoin or being on a topical retinoid, that works for all types of acne, so I would say that I'm very happy to see that.
Okay, and then the bar soap. We'll never know.
We'll never know.
All right, let's look at her products. Oh, okay, she's gonna take it through like this. Okay, all right, so her first product in her morning routine is her KraveBeauty Matcha Hemp Hydrating Cleanser. Great cleanser, especially for a morning. She's in the Philippines, says she has oily skin. I feel like this is in line with somebody who would want to use a cleanser in the morning.
Totally, 100% agree.
And this is a great one. It's not drying at all.
No.
Very hydrating.
I really like that cleanser.
And then she uses the Lumispa cleansing brush. Do you have thoughts on cleansing brushes?
I'm not a huge fan. I think your fingertips really are enough when it comes to cleansing, and beyond that, that increased exfoliation kind of can be irritating for people. So I'm more of a non-tools person when it comes to cleansing.
I mean, I personally love a silicone cleansing brush, but I can get why people don't like it, especially like the more classic cleansing brushes.
Totally.
Then she goes in with the I'm From Honey Serum. Looking at the ingredients, I have not tried this product, have you?
No.
It's technically a great product according to the ingredients as far as I can see. What are your thoughts?
Yeah, it looks like a nice moisturizer. You have glycerin, dimethicone, so things that are gonna soften and plump the skin. Yeah, it looks fine.
And then the I'm From Honey Glow Cream. Looks like it's perfectly fine. I have not personally tried this at all, but it looks like it's a great, technically it's supposed to be a great moisturizer.
Yeah, I think it's fine.
With that combination though, knowing that she has oily skin and that she's in a humid area, do you think that this might be a little bit too much, or do you think it's totally fine?
Yeah, I mean, I was sort of surprised to see like a hydrating serum followed by a cream, so I'm wondering if she's tried one without the other before and felt like it just wasn't hydrating enough, or she felt dry afterward. But I think it's okay if you're in a humid environment and have a lot of moisturizer on, as long as you don't feel like it's dripping off your face, like you're sweating a lot. I'm okay with it, yeah.
Yeah, and I only ask that because then she goes in with her sunscreen, which obviously we applaud and think is great. She uses the Missha Aqua Sun Gel SPF 50 PA++++++, which I've always loved a lot of the Missha.
Yeah, they make great sunscreens.
I will throw out there, they did pull them from the market and they're reformulating. I don't know at all if they were part of any of the Korean sunscreens that were pulled off of the market for that reason. They never actually were part of like the list of that or anything, but I do know that they pulled their sunscreens off the market to reformulate. Okay, so then going into her nighttime routine, so she's using a cleansing oil to start. This is the Near Skin pH Balancing Cleansing Oil. We suspect it's from Missha, but we weren't positive about it. And then she goes in with the KraveBeauty Matcha Hemp Hydrating Cleanser. I haven't used the cleansing oil that she mentioned, but it seems like it's perfectly fine.
Yeah, and a double cleanse like that, especially when you've layered on so much moisturizer and sunscreen, you really want to make sure that's off for whatever you're going to put on for your nighttime routine. So I love a double cleanse.
And then she goes in with the Ordinary Glycolic Acid 7% toning solution. I think it's, a very basic, good glycolic acid serum for exfoliation. Your
Absolutely,
thoughts?
yeah. I'm wondering what she's using it for. Is she using it to fight acne? She doesn't really say that she's struggling with hyperpigmentation much, so she might just be using it sort of in a traditional sense, just for an exfoliation and a little bit of extra glow.
And then she goes in with the Ordinary Retinol 0.2% in squalane when she's not using the glycolic toner. What are your thoughts on that?
I'm actually curious why she's using the retinol. Retinol is really good for pigmentation. It can help with oil control. It makes the skin more glowy. But if she's struggling with breakouts, using a prescription strength retinoid is probably going to be a lot more effective for her.
Yeah, or maybe like I've heard you say, like adapalene.
Oh yeah, absolutely. I still consider that prescription strength, even though you can buy it over the counter. Because it used to be a prescription.
It's true, it's true. And then she goes in with Nivea Creme for the eyes, which I personally think is actually a really good moisturizer. It's got like all the classic,
super thick and creamy.
Yeah, thick, creamy moisturizers. I have a video on this. I think as far as the base goes, it's essentially the same base as La Mer. So if you want to feel fancy, go for it. It's just a moisturizer. It's for the eyes. What are your thoughts? People know I say that eye creams are essentially moisturizer.
They are. They really are essentially moisturizer. And I think she had pointed out maybe that she had some milia around her eyes as well. And so you do have to be careful because one of the causes of milia, which is basically keratin, the skin protein, build up under the skin and to create these like little white pearls. And one of the causes of that is really thick creams. So it's just something to be careful about. It. Maybe she had milia before then, but if they kept coming or is worse, maybe switching to a more lightweight moisturizer around the eyes.
Yeah.
But yeah, I don't think you need maybe a special eye cream, especially one that doesn't have any particular unique ingredients for the eye skin.
I always say that I love a moisturizing or a hydrating eye cream during the day under my makeup, especially under concealer. Just want to keep it nice and dewy there. But if you're gonna use one at night, I think definitely having some kind of an ingredient like retinol or some kind of a brightening ingredient in it, that would be more the way to go. So she also has the COSRX AC Collection Ultimate Spot Cream. I don't know about you, but for me, if I'm using a spot cream for blemishes and acne and stuff, I kind of want some of those like killer ingredients, right? Like the salicylic acid or something like that, right? Even sulfur.
Yeah, absolutely, or maybe even benzoyl peroxide, but it looks like this one might just have zinc oxide from what I'm able to deduce from the ingredient list. So maybe if she's finding it effective, that's no problem there, but hard to know.
Yeah, well, for someone who's saying that she deals with acne though, right? Like this almost seems like a not very useful product.
Yeah, and in general, I think if someone has a lot of acne, spot creams are sort of, I don't use them a whole lot because you really should be treating the face globally even when you have new blemishes rather than going off after distinct spots.
Sometimes I'll talk about those little pimple patches and I'll see comments where people are like, if you're dealing with breakouts and acne all the time, these patches are so not worth it. And I'm like, it's true, they're not worth it, but if you're getting like an occasional one, then they're great. If you're dealing with tons of acne, you should be using something overall.
And if you're a picker or something like that, something to just remind you not to put your finger up there or try to pinch and pop something.
Yeah, that's true. That's a great reason to use a pimple patch. And then she finishes it off with the Laneige Lip Sleeping Mask, which is one that I really like. I know a lot of people love it.
Big fan.
And that's about it. Thank you very much.
She's so cute.
I know, and from that angle, I'm like, she's just glowing and perfect.
Totally.
So she gave us some really close shots of how her skin looks now also. You know what's something that I found interesting as, obviously not a medical professional, not a dermatologist, people still send me their pictures. So I do get a good glimpse sometimes of how people self-diagnose. And one thing I do see is people will send pictures where their acne kind of looks like this, and they tell me they think they have fungal acne. And that's almost exactly to a T what it looks like when they send these pictures. Do you have thoughts on this?
Yes.
And not at all saying that Lala thinks that she has it. She did not mention fungal acne at all. It's just an observation from me, and I'd love to hear your opinion.
Yeah, I feel like there's this wave of people coming into my office now telling me that they have fungal acne, and I think there's just some photos out there of people who say they've been diagnosed, and it's sort of this lower facial distribution. And I think a lot of people want to talk about that because it gives them a reason why their acne hasn't gotten better yet or hasn't responded to traditional treatments. And it's like, it must be because there's this alternative cause. And the reality is, one, fungal acne is not a thing. It's a folliculitis, so an inflammation of the hair follicle by Malassezia or a yeast organism. So we call it pityriform folliculitis or Malassezia folliculitis, but it's also very rare. So it really isn't that common. However, living in like a humid climate and things like that, you can be more prone to it. So it's something that I won't just like shut it down if someone's concerned that they have fungal acne, but it's just something to keep in mind that it's not super common.
I made a joke on Twitter. I was like, this time last year, it seemed like everyone had fungal acne online, and suddenly it must have been cured because now I see no one talking about it.
Yeah, everyone just got over it.
Yeah. I guess that brings up a good point too. It's like when people are self-diagnosing like that, there could be a lot of things going on. Like she might not have known, she could have totally came to us in this video and not known that she had PCOS. And it would be one of those things where you have to go see your doctor to get diagnosed with, whatever it is that could be causing these issues, right?
Absolutely, and I think, acne is not just a skin issue. There can be underlying hormonal things, not for everyone, but for some people. And that's why partnering with a physician, someone who's really experienced with this, can really help guide you. And it doesn't mean that you're always going to find some underlying systemic issue that's generating your acne. The vast majority of cases that won't happen, but it's important if that could be a possibility that you talk with your doctor.
Before I even ask this question, I want to remind everybody that this is not medical advice, and she would for sure have to see her own dermatologist. But when somebody is dealing with this persistent acne, or they tell you they have PCOS, which is going to affect their hormones and probably leading to what she's experiencing, are there things that you would suggest looking into with your dermatologist?
Sure. So I think, when my patients have PCOS, and I treat a lot of this in my office, We talk about oral birth control pills. They really are the gold standard treatment for people with PCOS. And then sometimes we even augment that by adding in spironolactone, things that are going to change how your hormones interact with the oil glands in your skin.
I know as a dermatologist, you probably don't want to add more to people's routines, whereas I'm over here like, just give me all the products, yeah. But when it comes to her routine, is there anything that you might suggest adding in?
I think if she was interested in adding some actives against to fight acne, doing a benzoyl peroxide cleanser, which is going to help control oil, but also help with inflammation on the skin, that might be really nice, versus like a salicylic acid cleanser, which is a little bit more mild, but also could be effective.
So maybe in the morning?
Yeah, switching out one of her either morning or PM cleanses with that.
You know, people ask this, can you use benzoyl peroxide or salicylic acid cleanser daily?
Yeah. Definitely. I mean, you have to listen to your skin, right? If it's getting too irritated or you're flaking, maybe not. But for most people, especially because it's in a cleanser form, so short contact time on the skin, you're gonna be able to tolerate it as long as you're still using moisturizers and other things to nourish your skin at the same time.
As far as her nighttime routine, I feel like you really stopped at that retinol that she was using. Not because you think it's a bad product, but because you just think she needs something stronger, right?
Yeah, needs a little more oomph, especially when you're treating acne. You really wanna have a prescription strength retinoid or adapalene. And so I think substituting tretinoin in for that retinol, even if it's just every other night, if she can't tolerate it every night, I think that could be really helpful for her. Something you'd want to keep in mind though is if you're going to continue using that glycolic acid toner, you just don't want to be using that exfoliant on the same night that you're using your tretinoin or your retinoid product. It tends to be a little too irritating.
The only other thing that I noticed is that she doesn't seem to have a true moisturizer at night. She uses the Nivea Creme on her eye area, and I'm not really sure how she's using the spot cream, but I'm going to assume she's using it as a spot cream, right? So she's going from using those moisturizers in the morning to not using anything at night to moisturize. What are your thoughts on that?
I know, it's kind of interesting. I think it might not be a bad idea to add a moisturizer in the evening too. Now, you don't have to moisturize twice a day. If your skin doesn't really feel like it needs that additional hydration, once a day is fine. I know, right? Stop. It's true, you know, there's nothing that says like you need to moisturize every 12 hours to keep your skin hydration adequate. So if she feels like she's not getting dry, that's fine. But if we're asking her to consider adding something like tretinoin in the evening, she might want to consider adding a full-on moisturizer in the evening too.
All right, well that was a really good one. I feel like she needs to go back to her derm.
Yeah, probably needs to strategize there a little bit in terms of how she's gonna treat her PCOS and how it's affecting her acne.
Yeah, for sure. If you want to send in your own skincare routine, we have an email address in the description box with a short description on what you have to do as well. Where can people find you?
So I have an Instagram account at Dr. Samantha Ellis, and I also have a YouTube channel.
And I love the YouTube channel. We'll leave a link to it in the description box as well. You can also find me on Instagram. I'm at Susan Yara, and we'll talk to you guys soon.
Bye.